the era of information and technology, getting informed about your health problems, getting suggestions, tips, and solutions is no longer a big deal. You just need to ask ChatGPT, Perplexity, or Google Gemini, and within seconds, you will see summaries of hundreds of research journals. Search on YouTube and you will find thousands of qualified doctors talking about a particular topic for thousands of hours. The question is, what's the purpose of getting informed if you don't actually follow it? Or you know what to do, but you feel like you just can't follow it. Today we chase complicated solutions, expensive supplements, fancy superfoods shipped from the other side of the planet, with glossy packaging and celebrity endorsement. Meanwhile, some of the most powerful gifts for human health are sitting quietly in nature, unmarketed, unbranded, and ignored. Today we are talking about one of those forgotten gifts, tamarind, a fruit from the Tamarind indica tree, sour, tangy, abundant, cheap, and often overlooked.
Tamarind contains several bioactive compounds, notably polyphenols, flavonoids, and organic acids such as tartaric acid, malic acid, and citric acid. The organic acids in tamarind increase gastric secretions and improve enzymatic activity in the gut. Clinically, this translates to better digestion of carbohydrate, protein, and improved bowel movement. That's why tamarind has been shown to reduce symptoms like post-meal heaviness and functional constipation. Several experimental and human observational studies shows that tamarind polyphenols can reduce intestinal glucose absorption, improve peripheral insulin sensitivity, and lower post-meal blood glucose level. Mechanistically, this happens because these compounds slow down enzymes like alpha amylase and alpha glucosidase, which are responsible for breaking down complex carbohydrate into glucose. This is the same enzymatic pathway targeted by some oral anti-diabetic drugs. Though tamarind effect is milder and supportive, not therapeutic. So clinically, we don't prescribe tamarind as treatment, but we do recognize its adjunct metabolic benefits, especially in early insulin resistance. Tamarind pulp contains soluble dietary fiber. Soluble fiber binds to bile acids in the intestine, forcing the liver to use circulating cholesterol to produce more bile. This mechanism has been shown to reduce bad cholesterol, improve lipid ratios, lower oxidative stress on vascular endothelium. In addition, tamarind flavonoids inhibit LDL oxidation, which is a critical step in development of atherosclerosis. So again, the benefit is not immediate, but long-term cardiovascular risk modulation. Tamarind provides potassium and magnesium in bioavailable forms. Potassium supports sodium balance and vascular tone. Magnesium improves blood vessel function and insulin signaling. In patients with borderline hypertension, adequate potassium intake alone has been shown to reduce systolic blood pressure by measurable margin. Now, an important clinical clarification: tamarind is not a medicine. It does not replace blood pressure, lipid lowering, or anti-diabetic drugs. But when used as part of a regular diet, it contributes to risk reduction, not symptom suppression. This is the difference patients must understand. Modern chronic diseases do not develop overnight. They develop from years of insults like repeated glucose spikes, chronic low-grade inflammation, mineral deficiencies, poor gut metabolic signaling. Tamarind addresses multiple small pathways like oxidative stress, digestion, lipid metabolism, and insulin response. That's why it appears consistently in nutritional research.